think the biggest thing whenever I'm trying to make an impact on a population of people, a third of African American men at age 30 have high blood pressure, have hypertension.
Mm-hmm.
Right? A third. And so, and they're not getting treated. So when you hear about someone 45 has an aneurysm and died, or someone 48 has a heart attack and died, they basically have had 18 years of hypertension untreated, and it's beating on their body until the point where they have an aneurysm 20 years later, they have a heart attack 20 years later. And that's because their blood pressure problems started at 28 or 26, or 30, right? So it's not, these things aren't randomly occurring. People are not just having a heart attack at 42. It's because their cholesterol was high and they didn't know. Their blood pressure was high and it wasn't treated. You see, and so I'm really pushing my patients to try to get one of those machines, those motorized machines you put on your arm, you press a button and it measures your blood pressure. And those are like $32 at Walmart or Target or something. And you can determine whether you have blood pressure without having to come to me, right? When people come to me and their pressure's high, well, I had ribs last night, or I almost had an accident on the way in, or I have white coat hypertension, or I don't like doctors, or hospitals. And so that's why it's high. So this way, if you can measure your blood pressure at home, you can convince yourself, under the most ideal situations that you can arrange, that yes, indeed, I do have high blood pressure, and it needs to be treated. Because the other myth, I'll have someone with a high blood pressure, 180 over 110. It's always that. That's good. It's usually higher. It's amazing how we can adjust. Well, that's just my high blood pressure. It's just not healthy. It's like stand in the middle of the freeway. You stand out in the middle of the freeway, you're going to get hit eventually, right? You keep a high blood pressure like that, something's going to happen eventually. And just ignoring that is not a good place. So that's just one example of that. So that increased hypertension drives increased heart attacks, drives increased stroke, and increased aneurysm ruptures, and increased kidney failure. All those things kind of can lead from that one point of inflection.
There's a lot of great information that you just shared there, but what stood out to me was the difference between what we know and then I guess what is kind of advocated or put out there. What is really out there to support men knowing this is something that's happening?
There's so much for an African American man to know about their health that it's almost like, where do you put your energy, right? There's, African American men have disproportionately the highest prostate cancer risk, the highest colon cancer risk. So there's people spending money educating people about prostate cancer, and there's a blood test that you can get to measure your prostate cancer risk without having to do a rectal exam, which a lot of men avoid. There's tests like, they have Cologuard out that allow you to screen for colon cancer without having them, do a colonoscopy. And so, the public health measures kind of go where the trends go. I'm really trying to push this hypertension thing because it leads to so much, and it can go, it leads to kidney failure, which has affected my family. It leads to stroke. My father had a couple of strokes. It's like every family, people have had heart attacks. Grandfather died of a heart attack, so, and you'd say, well, if you want to get the low-lying fruit in African American health, hypertension is probably it. It's either hypertension or it's diet, or it's obesity related to diabetes and things like that. But I actually think it's hypertension, it's high blood pressure that if we could bring attention to everyone's blood pressure, then we're going to bring down the heart attack rate, the stroke rate, the kidney failure rate, and all those related rates.
And so I've heard something about like adverse life conditions and things. So do you think that there's some level of just the struggles that we have as African Americans in this country that, in addition to individual decisions, also impact these rates?
Absolutely, yeah. No, there's adverse incidences, and there's just like life in general. Life, like being Black. That's stressful. I mean, and that increased stress can cause an increase in cortisol. And that cortisol causes increased sodium retention, and that drives up appetite and thirst and blood pressure, and It can lead to hormone problems that can lead to all sorts of things. And so in many ways, you could say that the oppression of being Black in America can cause health problems and probably has caused a lot of health problems. They say for sure when you see a child that's overweight, that is not an eating problem. That's a stress problem. That's an environment problem, right? Child that's overweight is that you don't address their diet, you address their living conditions. People as they get older, then diet can become more of a more of an issue. So that's now accepted. I mean, which when 20 years ago when I was earlier in practice, that was an overweight child was the mother's fault for feeding them the wrong food. Where now that's not the problem. That for sure, you're right. And so as we get to the point where we address different points, different problems, then that's when the money kind of flows to now let's put the money on hypertension, or let's put money on cancer prevention, or let's put money on exercise, let's put it on diet or nutrition. One of the things when I was writing the book, I did a chapter on lab results. I found out that African Americans have low magnesium and low potassium. Low magnesium is associated with an increased risk of diabetes. It's associated with increased, poor, mental fogginess. So if you're not clear, if you don't remember, trouble following instructions, that could just be a magnesium deficiency. And there are people that take magnesium to help them remember their scripts or help remember a number of things. And so those deficiencies, vitamin D deficiency, which African Americans, 80% of African Americans have a vitamin D deficiency, that can be related to increased infections, increased diabetes, increased cancer, all the things. You'll see vitamin D is related to they just came out with that replacing vitamin D lowers your diabetes risk. And so could it be that all this widespread diabetes in African Americans is related to vitamin D deficiency? So those deficiencies, when I was writing the book and that chapter on it, led me to develop a multivitamin that was specifically for African Americans, genetic sequence multivitamins. And so that was just really done to address health disparities, because there's disparities that's different in African Americans, that's not in Asian Americans, not in Hispanic Latino. That there is some vitamin D deficiency in Latino Americans, but most it's in African Americans, and it's not in Africans, right? Africans don't have big vitamin D deficiency because they get all the sun that's in Africa. We found there's increased zinc deficiency in African Americans that they think is related to the HIV epidemic. And increased COVID infections.
Oh, wow.
And also increased prostate cancer because of the zinc deficiencies that African Americans have. And again, if you compare, African American has almost 10 times the risk of prostate cancer compared to a West African. So it's not about being of African descent that puts me at increased risk for prostate cancer. It's being African American. So maybe that oppression increases my cancer risk, that increased cortisol. Now we add on zinc deficiency and vitamin D deficiency because we don't get that, the diet and whatnot, and we don't get the sun, and we live disproportionately in urban areas, right? And so in those urban areas, we're in the house, we're in air conditioning, we're not in the sun, we can't walk a whole lot, and be very active. And that has set up deficiencies in nutritional deficiencies that we need to take a supplement for, more so than say a white American, even in an urban area.
Thank you for mentioning the sequence multivitamins that you created. That is something that we can really be more mindful of as African Americans, and healthy outcomes is making sure that we're taking daily multivitamins and things to really.
Well, you know what, I'll tell you, and it's important that you wouldn't want to take a daily multivitamin unless it was the genetic sequence. You'd want to break it out, because you would want to take a vitamin D and a zinc pill and a potassium pill and a magnesium pill and a vitamin C. And that, because one of the things I found when I was doing the book was that people who took vitamin E at the normal dose, which is 400 IUs, which is international units, had an increased risk for lung cancer and prostate cancer. And so who has the highest risk for prostate cancer? African Americans, right? And so just by taking a multivitamin that has vitamin E in it, you're increasing your risk for prostate cancer.
Okay.
So I've been advising my patients, don't take a multivitamin because calcium, for example, is associated with an increased risk for prostate cancer in everybody, right? So, and I make a point of saying, don't just go by what I say. While you're listening, Google calcium and prostate cancer, right? And see, it'll say it right. It's right there online. Calcium is shown to be associated with increased risk for prostate cancer. Then read the back of your multivitamin. It has everything from A to zinc, right? It's got calcium in it. You don't need any calcium. You don't need any vitamin E. You don't need any selenium. The other thing I left out is in this, we call it genetic sequence multivitamins, is we left out vitamin K. Vitamin K causes your blood to clot, right? So if when you cut yourself and you're bleeding, it's the vitamin K in your system that causes your blood to clot. But what racial group of people have the highest risk of clot in the brain? Stroke. African Americans, clot in the heart attack, clot in your legs, they call it DVT, deep vein thrombosis. So we have the highest clotting risk after surgery or anything. And then my research showed no deficiency in vitamin K, no deficiency in vitamin K. So if you have no deficiency in vitamin K and you have the highest risk for blood clotting, would you want to take something that has vitamin K in it? No, no. Read your multivitamin and see what it has in there. It has vitamin K in there as well. So you want to be, I say, it's like making a cake. You make a cake, and it says calls for 3 eggs. 6 eggs isn't better, right? 3 eggs is what's supposed to be in there. You don't just throw 6 and no extra cup of sugar, throw it, half a thing of vanilla. That's not how we do it. There's a special recipe that gives you the cake that you want. But people take that approach, and I say only with money is more better. Right? You can have too much water, you can have too much vitamin C, you can have too much vitamin D, you can have too much sun, you can have too much of anything. And so you want to take something where someone's thought about how much you need of this and how much you need of that, based on your history and your environment. It's not just genetics, it's, even though that's our name, but it's also based on, just what the research shows based on where we live and what we eat. And, and that information allowed me to just devise a multivitamin that addressed that. But you don't have to buy it. You can I'll tell you, you can get 2,000 international units of vitamin D, 500 of vitamin C, 15 of zinc a day. And that's free. You can do that. But once you bought that, you can afford a genetic sequence multivitamin, but you don't have to buy it. You can just kind of get it that way. And it's on sequenceMultivitamins.com. But thanks so much for having me on. I appreciate you. This has been a great interview.
Yes, thank you so much. We appreciate you as well. This has been wonderful information.
Thanks so much.